Hello, everybody, and welcome to our Pace College of Health Professions Dean's Roundtable. I want to let everybody know that this program is being recorded for future use. It is great to see all of you here, and I'm very pleased to be introducing our speaker, Kate O'Keefe Cotter. Kate is recently retired as Vice President, Quality Management, Risk and Regulatory at Northwell Health, Northern Westchester Hospital in Mount Kisco, New York. Kate has over 40 years experience in the healthcare field, receiving her Bachelor of Science in Nursing from the College of Mount St. Vincent, followed by a Master of Science in Nursing and certification as a Family Nurse Practitioner from Pace University and the Lienhardt School of Nursing. Kate began her career working as an RN in several specialty areas. However, her interest in patient advocacy and safety led to a position in the Office of Legal Affairs and Risk Management. After several years, Kate returned to a clinical role as a family nurse practitioner, caring for children and their families with HIV/AIDS. She then transitioned to Blythedale Children's Hospital, where she coordinated the care of adolescents admitted for intensive inpatient rehabilitation and the management of complex medical patients. Kate was also an adjunct professor at the College of Mount St. Vincent for the Master's Nurse Practitioner program. Later, Kate returned to a quality, risk management, and compliance role in 2007. Starting in 2010, she was at Northwell Northern Westchester Hospital, where she developed and implemented the hospital-wide QI plan. This plan oversaw a number of different areas, from departmental performance measures and improvement priorities to root cause analysis and nursing education. Her team also worked on magnet recognition, regulatory affairs, and accreditation readiness. Kate, a big welcome to our Roundtable series. We are so pleased to have you with us. And at this time, I would like to turn it over to you to share a bit about your experience in PACE and your journey. Thank you.
Thank you, Dean Ty. I'm exhausted listening to all the things that I have done in the past. I'm happy to be here, and I hope to just provide you with some interesting information on my career and the path that I took. You will find that I am a huge fan of nursing in general and the healthcare profession. It gives so many different opportunities and different ways that you can use your skills. And I'm going to give you a brief overview of what I've done. As Dean Ty said, I started my career as an RN, bedside nurse. I remember being scared to death, to be perfectly honest. You get wonderful training, as I did, but it's very different when you get out there and you are dealing with the patients, with their families. It's interesting, it's exciting, at times it's daunting, but it's never boring. I do believe that I needed to work as a bedside nurse just to really hone my skills. One of the biggest things that you need to learn how to do when you're working in healthcare is to learn how to organize your time in order to get all the work done. But I worked in a large academic medical center in New York City, which provided so many different opportunities. I moved usually every 2 to 3 years to different areas because I wanted to be challenged and I was curious. It's one thing that I say to everyone: stay curious and you'll never be bored. You will always have opportunities. So after a few years working as a clinical bedside nurse on a surgical unit, I then moved to, I actually took a brief time for about a year, and I worked with one of the oncologists in his office, which was down the road from the hospital, and then came back. So I would be going back and forth between seeing the patients in his office and then managing the patients in the hospital and also assisting him with doing the research. That was one thing that I truly liked about working in a large academic medical center, was the opportunity to work with some amazing researchers, some brilliant people. At the time, the research I was doing with that oncologist was cancer research, mostly hematological, lymphomas, leukemias. But then I ended up moving back into the clinical role in the hospital, and I went and I worked in the neonatal intensive care unit. And that was such a different world, working with adults and then moving to these tiny, tiny little people. But it was, again, cutting edge work. There were new things coming out all the time, so it was always exciting. And I did have the opportunity when I was doing that to do some transport nursing. So that meant where the NICU going out to smaller hospitals in the outer boroughs, up in Westchester and further north, and bringing some of the premature infants down to the NICU in the city. I also had the opportunity to do helicopter transports. Again, I was in my late 20s, so I was a bit of an adrenaline junkie, I think, but very exciting. And again, being on the cutting edge. And then I was also given the opportunity to work with another oncologist on a nurse-managed oncology unit. In an academic medical center, you have a large team, you have residents, you have interns. And there was a pilot program where the nurses on the unit worked directly with the attending oncologists. And at this time, we're talking in the 80s, patients spent a bit more time in the hospital than they do now. So it was patients who had cancer who required chemotherapy for more than 3 to 5 days. So they would come in as an inpatient and we would manage their care. So that actually gave me the idea of wanting to go further and become a nurse practitioner. But that kind of got waylaid a little bit because my father was a lawyer and I always liked law and I liked the way it applied to medicine. And when I had started at the hospital, I heard a lecture by the general counsel for the hospital and the director of nursing and how they worked together. And they spoke of how things can go wrong in a hospital. We have buildings full of human beings and human beings make mistakes. We put in processes around them to prevent those mistakes from reaching the patient, but sometimes things happen. And what they talked about was their role is to look at what happened. What was the event that happened? And was it preventable? Was there something that could have been done differently to prevent that from happening again? I thought that was very interesting. And I then worked with a woman. I moved to the emergency room. So I went from tiny little people back to big people in an emergency room in New York City that was very busy. But again, honing your skills as a nurse, doing your assessment, looking at people coming from all walks of life, and they're coming into the emergency room probably in their worst state ever. And they're anxious and the family members are anxious, and learning how to navigate that situation and often de-escalate a situation when people's anxieties and fears are so high. You spend a lot of time really managing that. And that is a skill that takes time to hone. And then also you learn how to work with your team, and your team is enormous as a nurse. You have your other peers, your other RNs, you have management, you have all the different departments that you have to work with, whether it's environmental services, the people delivering the food, physicians, therapists. There's just an enormous team that you work with, and learning how to manage that and use everyone's skill, because you can't do it alone. It's a big job and it's a big responsibility, because you as the nurse are the patient advocate. And that was one thing that I always felt very strongly about from the start. I was there for the patient and to do whatever I could to ensure that that patient received the quality of care that they deserved. So the emergency room was fun and it was very, very interesting. But then I went and actually worked for 2 years up in what was called at the time the recovery room. It's now called the PACU, the post anesthesia care unit. Again, a very large PACU. We had, I think, about 50 beds. So again, the opportunity to work with many of the surgeons and the anesthesiologists and learn a whole nother aspect of caring for the post-op patient. And that was very, very exciting. But I had become friends with one of the nurses in the emergency room, and she moved on to the Office of Legal Affairs. And I thought, wow, that might be really interesting. And maybe I might want to go to law school. I actually did think of, I looked at Pace's law school. Do I want to go down that path? Because there's so many different things you can do. But I ended up working in the Office of Legal Affairs. And what that role included, I was a nurse investigator. So there were 4 or 5 of us, and we worked with the attorney, the 2 in-house attorneys for the hospital, and then with the law firms outside that actually did the trial work. And we were the people, when there was a lawsuit lodged against the hospital, we would look into every aspect of that care. And that included interviewing everybody involved, whether it was the nurse, the surgeon, the resident, the intern, whether it was we had someone slip and fall in the hallway. So I had to learn what was the slip resistant factor of the wax that we used on our floors, because it made it look shiny, but it really wasn't slippery. So, you learned everything. And again, as a nurse, a young nurse, I was going into sometimes the chairman of these departments, and I'm asking them what happened. So you did learn how to communicate and not put somebody off, and ensure that they trust you and are going to answer your questions honestly. That was an amazing skill to learn. So while I was doing that, as I said, I considered law school, but then realized that I really I liked the way medicine and law intersected, but I really liked clinical medicine. So that is what brought me to PACE, the Leonhard School of Nursing, to become a family nurse practitioner. And I chose that because at the time, my experience as a clinical nurse had been both with adult and pediatrics. And I thought doing the family would just be give me broader opportunities. That has since changed, because I think now you have to have acute care to work in a hospital to take care of adults. But I loved going to PACE. I went to the Pleasantville campus because I was living up further north of the city, and really had a wonderful, wonderful training and wonderful opportunities there. And that led me to work with they called it the Pediatric Center for Special Studies at this organization. And it was a time in the early 90s when HIV was still a big problem. And it was right around the time when they had just identified, they had a clinical trial that was looking at AZT, and they had quickly identified that if you gave the AZT to the mom when she was pregnant, the HIV was not passed on to the baby. So that was a game changer. And I had the opportunity to come into this group as the nurse practitioner, working with the children and also managing their clinical trials. So that's another aspect, something that I didn't realize that was available in this way. I was able to travel down to Washington, D.C. because we did NIH, the National Institute of Health clinical trials, learned a tremendous amount from that, in addition to the industry clinical trials. At the time, all the pharmaceutical companies were doing clinical trials on the different drug cocktails for our patients that were HIV positive and or had the AIDS. So that was very, very exciting. But I ended up moving probably about 80 miles north of the city. And after 4 years of commuting into the city back and forth, I was given the opportunity to be the nurse practitioner on the adolescent unit at Blythedale Children's Hospital in Valhalla. And I don't know if you are familiar with Blythedale, but it's an amazing place. And it still is an amazing place. Many children who have traumatic brain injuries, spinal cord injuries, neurological disorders, orthopedic surgeries where they need extensive rehab, infants that are ventilator dependent, but no longer need to be in an acute care setting, go to Blythedale. And that's where they receive speech therapy, occupational therapy, physical therapy, vent weaning, trying to get them off of that ventilator. It was quite an experience are, again, the team you're working with. I really didn't realize the extent and the importance of all those different therapists. They're amazing. Child life therapists, people, young women and men working with these children with their art that helps them. It was really very impressive place to work. So I was there for 7 years and loved it. But again, an opportunity came up for me to move back into the risk management role. Quality management. And one thing that I learned early on is good quality care is good risk management. We have to realize that no matter where you work, there is part of it that's a business that you need to continue. It is a business, and good risk management and good quality management go hand in hand. If you provide quality care, you will have a good risk management program. So I then was given the opportunity to go to Northern Westchester, which I really thought that was probably one of the best places that I worked, aside from working in New York City. The opportunities there led me to be responsible for, as Dean Ty had said, overall quality management for the hospital. When you work in a hospital, there are different metrics that need to be met, and all of those metrics are focused on the quality of care that you provide. So we needed to make sure that we had processes and procedures in place to keep our patients safe and to prevent any issues that occur from reaching them. An example of that is you don't want patients to fall. Patients fall in a hospital, they generally will hurt themselves. So what can we do? What are the processes in place that we can do to keep our patients safe and prevent them from falling? You don't want patients, if they have a indwelling Foley catheter, you don't want them to get a urinary tract infection. So there's all these different things that you can do to make sure that you have a zero occurrence of urinary tract infections. And we were able to do that at Northern Westchester Hospital. It is possible. So all those different aspects of quality care, and then including nursing education. Nursing education in a hospital or organization is vitally important. They don't only educate nurses, they educate everyone on the team, given the opportunity. They're an incredible group of people. And I also oversaw infection prevention. So the infection prevention program in the organization, which became really interesting because the last 2.5, 3 years of my career was during a pandemic. So infection prevention really took center stage at that time. But again, that was an incredible experience because watching an organization pull together, put the emergency management plan in place, and keep everybody safe, patients and staff. Because in the very beginning, we did not know what this was or what was happening. And honestly, many patients were dying. And everything that we normally would do to care for those patients wasn't working. And as a matter of fact, putting them on a ventilator actually made them worse. So it was an unbelievable experience to watch everyone pull together and work together to make sure that we could take care of our patients in the best way. There's so many different ways. I happen to have chosen to work in a hospital setting. I liked working in a team. I liked having the people around me, but there's so many other opportunities. You can work in a school. I have friends who are school nurses. You can work in a physician's office. You can work in a clinic. There's just many, many different opportunities. I chose where I chose because having a large academic center, I moved many different places over the course of 20 years when I was there before I moved out of the city. And it was always exciting and always a challenge. That's kind of a brief overview. Let me see if I missed anything here. I think I pretty much gave you most of my experiences. So I'm curious to know if you have any questions, and anything else I can add for you?
I guess I have a question. What was the most like impactful part of like your process and I guess of your job? And would you do anything differently, like looking back?
Good question. No, I don't think I would do anything differently because I felt that when I was initially, taking care of patients clinically, one-on-one, I had an impact on that patient. But as I moved through my career and took on different responsibilities, and then my last 10 years, I had the opportunity to have a greater impact on a greater number of people. And that was the most rewarding thing. Um, there were so many different ways to do that, but I felt in my last role, I really could make a difference in the greater organization to a greater number of people rather than just the one-on-one. I did miss actually when I was being more administrative management, I did miss some of the clinical work that I used to do, but I really felt like this was my role at the time.
Thank you. I also have one extra question, if that's okay.
Yes.
Since some of us are students, I guess what tips or what advice would you give for us, or kind of what mechanisms worked for you to kind of handle, I guess, the burden, for a lack of better words, or like the stress of like going through like a healthcare profession?
Mm. Yeah, that is one thing. You're in the healthcare profession, as rewarding as it is, there are days that are tough. There are situations that you're going to come across that are tough. And I would say the most important thing is never, ever be afraid to ask questions. You can't possibly know everything. And the best thing you can do is to ensure if you don't know something, ask. There's always someone around. You have your managers, you have physicians, you have other experts, pharmacists. There's always someone to ask when you don't know something. That I think is one of the most important things you can do, especially early on, because there's a lot. There's a lot. And it's okay to feel, as I said, I remember my first few days walking in that hospital, I was scared to death, and that's okay. I think if you're not, there might be something wrong because as I said, it's a big responsibility, but you're well trained. Your program is excellent. You have so many skills, the skills center. I saw that skill center in the city for the first time. That's incredible. I didn't have that. You have an opportunity to get experience before going out into the real world. But still, when you go into the real world, all the skill training you can have, you're still going to have human beings that have so many different nuances and characteristics and quirks that you'll be introduced to and will learn how to manage, and you'll be fine.
Thank you.
You're welcome.
I had a question that was actually submitted when some of our students registered. I'd also like to take this opportunity that anyone who might be having mic problems or is feeling a little shy, you can message the question in the chat and I can read it on your behalf. But one question that we received was, what was the hardest part of completing your nursing education and how did you overcome it?
I think the hardest part of my education, well, it's twofold. When I was first going through my bachelor's program, it was learning the challenge of the clinicals. That was my hardest part, and managing my time. And it took me a while. I had a tough time my first year. It just took me a while to figure out how to study. I actually was someone in high school who didn't really have to study that hard. And when I got to college, all of a sudden, I'm like, I really need to learn how to study. It's very, very different. I got my first ever only D in chemistry, my first semester of college, and totally freaked me out. And then I figured out how to study. That was one of my biggest challenges early on. When I went for the master's, it was a challenge to balance because I was working full time and going to school. So that was a challenge. And then it was a challenge to transition from being a registered nurse where you worked with the physicians, you took the orders, you implemented the orders, to the person who was giving the orders, writing the orders. That's it. It's a different role. And it took me a while. I was fortunate to work with a wonderful group of people. That was when I worked in the Center for Special Studies, and there were 3 nurse practitioners, and we worked with 2 infectious disease fellows and 3 attendings. And we had this clinic cared for these little people that most of them had gotten HIV from their moms because it was before the AZT had been really available to them. And the other opportunity at that time I forgot to mention was we noticed that many of the mothers, they brought their children for care, but they didn't go to get care for themselves. For some reason, we did have an adult center for special studies, but for some reason they just didn't go. And one of the attendings was board certified in pediatrics and in internal medicine. So I was able to partner with him, and we started seeing the family. I started seeing the moms and the babies and ensured that the moms got the care that they needed. So again, that was something that that's why I always say be curious and be open, because opportunities are there. But you have to be open to see them and take them.
I just encourage our great students or anyone who's joining us to jump in the chat or unmute.
I have another question. So I have a fascination with working with kids and like child development. So what was like the best and the worst part of working like with little people?
Little people are amazing. Working with the children who have illnesses they end up coming across almost as wise beyond their years, especially children who have chronic diseases. And it is so rewarding working with them. It can be very tough. It can be very sad sometimes. And the age of the child that you work with, it's very different. Whether you're working with a toddler, because you have all toddler behaviors, but you still need them to do some things to keep them well, or whether you're working with teenagers, which I was on a teenage unit, and they were teenagers that had all varying abilities and disabilities, but they all had the same hormone levels. And there were boys and girls on the unit, and we had to keep them separate. I mean, it was just, there's things you don't even think of. The harder part, I think, in working with children is when things don't go well. It is sad, and it can be very challenging. You're not only working with that child, you're working with the parents, and you're working with parents who are unbelievably stressed. Many of them are in the worst situations of their life. We had a young girl who was in a horrible, horrible car accident and was very, very brain damaged. And she was only 16. And, helping her parents, and it wasn't only her parents, her aunt ended up coming and staying at the hospital and trying to help out and learning her care. So it is not easy, but you can do it. And again, you're not doing it alone, you're doing it with a team. But that probably was one of the biggest challenges for me is how you help the parents when you're taking care of their child. Another thing that you learn how to do, we all have lives and we all have things going on in our own lives, good and bad. And learning when you walk through those doors, you're there for the patient. And you can't always do it. There are moments that you might have to step aside, but you really have to kind of put your stuff aside and focus on the people in front of you, because that's why you're there.
How did you overcome like those emotions, or like not overcome it, because I feel like it's something that you never really overcome because there's such impactful situations, especially with kids. I mean, you know, they're little beings and you see them kind of like fluctuate with health. So I guess how would you, or what recommendations would you give to managing, I guess, those situations and those emotions?
It's a good question. I think everyone has to find their own way. One thing that I recommend, and this again is why I preferred working in an organization where you have people around you, your peers are an amazing support when you're working together. Recognizing your emotions, knowing them, and learning. For me, I ran. I would get off shift and I would run. There were other times that you had to allow yourself to cry. There were times we had a back room when we were in the emergency room, and there were some times where you would just have to go into the back room and take a few minutes. And I worked with peers that absolutely understood that. There was one time when one of my peers says, "We're going in the back," and just take you out of that situation to allow you to feel, because you're human. I had one day in the emergency room where just the timing, I had one cardiac arrest after another that came in, brought in by ambulance. And I remember two of them I was able to send to the ICU, two of them I had to send to the morgue. But you're so busy doing what you have to do. For me, I didn't have time to think about how I was feeling. I was doing my work. The last patient was a gentleman, and he was an older gentleman, had a heart attack, and I was doing post-mortem care, and I took his jacket and a piece of paper fell out of it. And I looked at the piece of paper, and it was obviously his wife had written him a list of things to buy when he comes home from work with a little heart. I lost it. I went through the whole day and did everything I needed to do, but fortunately, I had my peers. I had to go into the back room and take a few moments for myself. So it really is what helps you manage your emotions, and you have to learn that for yourself, but you do need to find it. Some people find it better to talk to somebody. I mean, there's so much support in an organization. It's just, you do have to find it for yourself, what's going to work.
So you may have answered this, and I missed it, but if someone is looking to get into the risk management side of it, would you recommend them taking, adding any kind of business education onto that as well? Or do you think they would be more than successful with their nursing background?
I think starting out, you're fine with your nursing background, because what the organization needed from me was my nursing background. They had attorneys. And then I think as you go on, there are different courses you can take, but you don't have to. I know there's legal nurse consulting courses and things, and I did look into that. But honestly, what they're looking for, and the attorneys that I worked with, they wanted my expertise as a nurse and my ability to look at a case and explain the medicine. My role for them was to look at the case in great detail, understand what happened, and explain, number one, to the attorneys exactly clinically what happened to this patient. Was there a departure? And then learn with the attorneys and with the insurance company, what was the value of this case? So that was all learned in the role. So I don't think you necessarily have to take additional education in order to do that. Because they really are looking for your experience as the nurse and helping them understand the medicine. Because remember, the trial attorneys, if it goes to trial, most cases don't go to trial, but if it does, they have to then explain to the jury what happened here and why it happened and why it was not a departure, which is, they're defending the hospital and the practitioner.
I'm My name is Lu Shi. I'm a professor at Department of Health Science. I work on the intervention of stress reduction on various populations. So I'm currently actually looking for the kind of healthcare organizations or group of healthcare professionals who might want to be interested in doing a joint intervention in stress reduction. In cases, for example, the emergency department nurses. So wonder if you can have any advice of where to find this kind of collaborators. What I'm trying to think about is a quick workplace stress reduction technique that we can jointly develop and test.
Yeah, I think you could find that really in any hospital. Like Northern Westchester Hospital is part of Northwell Health. Northwell Health is a
Yes.
very, very large system. It's actually the largest healthcare employer in the state. So there might be an opportunity at, but I would start, I think, out in Long Island at the corporate level.
Okay.
Because they could help identify, I think they might be interested in something like that. I'm not sure if they're doing something like that already, but they have 23, 24 hospitals, and hospitals are not the only place you're going to have stress.
Sure.
They have a partnership with the Go Health urgent care centers. And even there, you have people coming in different states, and you have people who come into the urgent care center that really need to go to the emergency room. I mean, you're going to have stress really in any site that you can find, but I would think the corporate level might be a better opportunity. I'm not really sure. Most of the people that I knew there have actually retired because they're my age, but
yeah, thank you.
if I can think of anybody, I will certainly, I can pass it on to Joe or to Dean Ty.
Yeah, we can be the connecting person. So that'd be great. Thank you.
Yeah, thank you.
You're welcome. It's good work. It's needed. Actually, now that I think of it, you might want to look into, I don't know how that would work, but there's a center, a therapeutic center in Cold Spring, and they work with horses, and they've been doing therapy with, veterans and disabled persons, but the director is looking to do something with first responders.
Oh, okay.
Equine therapy. So Joe, I'll send you the information. It's called
That'd be great. I can pass it along. Thank you.
Because I've spoken to her last fall before we came down to Florida, and it's something that she's considering doing for first responders, and I think that would be really excellent.
Yeah, great. Thank you.
You're welcome.
I have another question that came in when students registered. During your time in your nursing practice, what is the biggest misconception that you saw when it came to public health?
Wow, that's a big question.
The big question.
Wow, the biggest misconception.
Maybe one misconception. Maybe we'll rephrase it.
The what?
One misconception, not the biggest.
Yeah. There's so much. We actually are very fortunate in the United States, because I do have friends that live in other countries, and we have so much available to us in our healthcare, but sometimes it's not that easy to access. I think for the public, it's very difficult sometimes. I try, I've navigated in healthcare for 40 some odd years. But when it came time for me to actually look at some health insurance, it is really difficult. It's trying to navigate to find out where you need to go, what you need to get, and the cost is amazing, because working in healthcare, I never even thought about health insurance. Never, because it was just, I worked in a large organization and I was covered under their health insurance program. and paid very little money, you know, of my own money. And I had the best healthcare. When I then retired before I was 65, I had to go looking for health. I had to go onto the New York Exchange and navigate that whole system. And even with my background and my experience, it was not easy. And I think that's the toughest challenge to the public is I think the care is there, but accessing it is not always available, easy.
Hi, I was just wondering, I'm like not sure kind of what direction I'm like leaning to go to, and I was curious when you were talking about like how you shared the story about how you had to do the interviews when there was like a situation in the hospital and you were the one that had to conduct all the investigations. I was wondering if you could talk more about your time during that. I was curious.
Mm. Yeah, that was again, when I first had to go interview some of these physicians who were these renowned physicians, and here I am, a 31-year-old nurse, and you have to remember, I was going in and talking to them. I didn't have the internet. It didn't exist. I literally would go when I had the talk to the top neurosurgeon about what happened during the surgery. I literally went with a picture from my anatomy book and went into this physician and said, help me understand. So my biggest thing when I'm talking with people and what I learned is to say, help me understand what happened here. You know, I learned a lot from the attorneys I worked with because they were quite skilled at conducting interviews. And I learned that, and then I used that throughout my career. Whether I was doing the investigation as a nurse investigator in risk management, or whether I was talking to someone in my hospital when I was a vice president, asking them about the quality concern we had, approaching people, learning to approach people without making them feel like they are being targeted. You know, you want someone to feel comfortable, and the best way that I found to do it was I would say, help me understand what happened here. You know, I need to help, I need to be educated on that. That was the one thing I did when I went to these top surgeons, because it made them feel really good when I said, educate me. Teach me what you did with this little figure. What happened when you did the brain surgery? There are different books and courses that you can look into to give you some tips on how to conduct an interview, but again, it's a skill. And I will tell you, when I first started doing it, I made some mistakes. I went into some interviews, and when I left, I'm like, that just did not go well. And I basically came back to the office and talked to the attorney I worked with and said, I totally bombed this interview. And we talked about it, and just doing that kind of work, talking about it, recognizing, all right, what did I not do correctly? And that's one thing throughout my career. I made many mistakes, and there were things that I did not handle well, especially when I started going into more positions that were leadership positions. Early on, there were some interactions I had, and I'm like, that was really not the right way to handle that. But you learn. And that's the whole thing. Just don't be afraid to learn. Don't be afraid you're going to make mistakes. You learn from them and you move forward. Does that help?
Yes, thank you.
You're welcome.
I have a question, and this is a challenging one. With all of your insights, both from patient care and from leadership, if there was a magic wand, and you had a magic wand, but that was within the realm of what you think might be possible in terms of improving access to healthcare, what do you think, students and those of us who are active in the field should be advocating for in terms of what's reasonable? Because we know there are, issues with affordability and insurance and access and equity and structural issues. And what are your insights for what you think are best for us to advocate for that's possible?
That's a big question. I think, all of us in healthcare, everyone in healthcare that I've met, everybody's there because they want to do the right thing and they want to take care of patients. I really did not come across anyone who wanted to do anything other than that. The challenges that I saw were the people's, I would say more like pharmaceutical companies and insurance companies that control the cost. And it creates a huge problem, and it often doesn't allow the people who really want to do the right thing to do their work. I think, trying to think how to say this. It's become a bit of a machine, working in healthcare. Our doctors and nurse practitioners, often when we're working in a organization, you are pushed to see more and more and more and more and more patients in shorter amount of time. And that does not set a scenario for you to provide the best possible care. I think that is one of the bigger issues now. We have all of these large systems, and it's become more about the money than actually, not everywhere, but it's a problem. Many physicians that I know have actually left the practice because they can't provide the quality of care, the type of care that they want to. I think that's caused the expansion of concierge medicine, where you actually pay for the medicine and you have a provider, and that is your provider. You don't see 10 different people. You don't have to wait 3 months to see a provider. It's just become much more complicated, I think. I'm not sure actually what the answer is for where to focus the advocacy, because I think there's a lot of different components that feed into that. Sorry.
No, that's wonderful, and I think very insightful. You know, I'm always impressed by how much our students want to both be practitioners, professionals, and also change agents. And I think that's very insightful, and just how
Yeah.
complex
But
it is.
and there's a lot of different things that you can do. You'll see as you get out there and you start working, you'll see opportunities to be a change agent, and it can be very small. I mean, small things end up aggregating to bigger things. So I think just again, being open to what's around you and how you can make things better. And even if it's in your small little area, that can expand beyond that. So that's a start. That's where you start.
Well, I just want to add, it's one of the things that I've learned actually in class, at PACE. And it's like, as a nurse or just as a healthcare professional in general, like you educate the patients on so many different things and like how to access healthcare and like where to go and where to find all these resources. So I think that's also like a way to advocate, I guess, for that.
Mhm.
And so like it's a small portion of it to such like a broad problem per se, but at least we're all kind of doing our part in some way, shape, or form.
Right. And you will find you will educate and advocate for your patients, but you will have every friend or family member calling you once you're out there working for your advice, recommendations, and you are helping people all the time. Whether it's giving them a recommendation for what's a provider to go to, or how they should manage this, or how they can access that. You will spend your life educating and advocating for people. And it's wonderful.
I have a quick follow-up question to that. Were you involved in any professional organizations or groups that maybe served
Oh,
as like an
yes.
avenue for you to be an
Yeah,
advocate
I
or
mean,
just to continue educating yourself?
yeah, I mean, throughout my career, I was part of the American Nurses Association, various organizations. I was certified as a quality professional. In my different roles, I absolutely participated in the national groups. And really, I thoroughly enjoyed going to various conferences for those groups, because that was another avenue for learning. And then working with colleagues and publishing, that's another thing. Writing articles and publishing is another avenue that is very exciting. When I was doing the work in clinical trials, we published. When we were doing all the different work with our children with HIV and AIDS. We published many articles and traveled and worked at different conferences and joined several of the organizations. That's a wonderful way to make a difference, because that's the larger group.
Thank you. I remember hearing that when I was in college and ignoring it, and it's true. You should
It
all
is.
join your professional organizations if you can.
Absolutely, because that's where you have a voice too.
And a network.
Yeah, we worked at Northern. We several of us, nurse practitioners and PAs, we met monthly. And it was interesting to have the nurse practitioners and the PAs, because our roles, we have a little bit different regulations that dictate our practice. So just learning from each other, what each group is doing and what research is happening and what changes are happening in regulatory. You always have to be aware of the laws that dictate, that oversee your practice. So just continuing to learn about that is very important. I hope I've given you some good information and a perspective on what it is to be in the healthcare profession. It is a profession. It's not just a job. It's a profession and a wonderful career.
Well,
Thank you.
sorry.
Please, Sarah, go ahead.
I don't have a question. It's more just like a comment. And it has to go with what you just said. As a student, like we face so many like highs and lows and like how to manage kind of going through our studies, but it's such a fulfilling like career in the end. So just hearing all the different possibilities and, everything that you have accomplished is just it's almost like it impulses you to, want to finish and do better and do more. So, I just thank you for sharing.
Oh, you're very welcome. I'm glad. That was my
Couldn't have
goal.
couldn't have said it better myself. Thank you so much, Kate. Thank you for our students and other guests. And students, please let your friends know because the recording will be up so we can benefit from Kate's insights and wisdom and the great discussion that we've had today. Thank you again.
All right. Thank you, everybody. Good luck. Good luck in your
Thank
studies.
you.
Bye, thank you.
Thank
Bye-bye.
you.